What do we know about if and how the virus is mutating?
Well, we know that all viruses mutate, and we know that this virus mutates at a relatively slow rate compared to other viruses like HIV. One of the interesting issues is that there's a variant of the virus that has become quite common in the United States and Europe, and some virologists think it may be because it's more infectious, it's sort of outcompeting the other variants of the virus.
Dr. Sharfstein, we also have a story on the Bloomberg terminal saying that basically Southeast Asia detected this mutated virus strain sweeping the world. Now, what are they talking about? This is the variant that we find in Europe and the US, but it could suggest that it's just more infectious, or it's becoming more infectious than in the past.
So this particular variant has a slightly different protein on the outside of the virus, which may allow it to grab on to the receptors a little tighter, a little more effectively, and as a result, be more likely to cause an infection. We don't know that for sure. Some people really think that's the case. I suppose it's been detected in Malaysia now, which would be evidence that it's spreading around the world. There's no suggestion, as far as I can tell, that it's more deadly, for example. It's just a virus that is now moving around. I don't think it changes any of the core things that people need to do in order to protect themselves.
Joshua, where are we on vaccines? So we had the Russian vaccine. Many people around the world, reluctant to take it, certainly because they haven't gone through the same steps as a vaccine would go in Europe or in the US. But does it give you hope that antibodies work, or is it just too soon to say?
Yeah, they called it Sputnik to make it seem like it was a scientific achievement, but it really wasn't a scientific achievement. It was just an assertion that this this vaccine is a good one, and there's no evidence yet for that. So we'll just have to see what the definitive studies show, the phase 3 studies, because you really have to look at the effectiveness and safety of vaccines before you can give them to a lot of people.
So what do you worry about the Russian vaccine? Is it that it could have side effects, or that it just doesn't protect against COVID-19?
Both. They don't know either, really. So, they just haven't done enough studies. These studies, though, are underway for several vaccines, and I think we will get some good data about whether the vaccines work and what their safety profile is. And hopefully, at least one of them really does have a major impact on the chance that someone will get ill with coronavirus.
How do we understand outbreaks in schools? I don't know, with the resurgence of the virus in certain pockets, even New Zealand, is it possible to see how the virus moves, who gets infected, and how does that help us reopen schools safely?
Well, I think the recipe for reopening schools safely is still the same: get community transmission down and take precautions. There seems to be plenty of people who aren't following that, basic guidance, and I think we're likely to see outbreaks as a result. If the community transmission rate is really high, then it's likely to get into schools and be quite disruptive as the teachers and the kids get sick, even just from community spread. And then if you don't take precautions, kids clearly can give it to each other, particularly older adolescents. And so, just like we saw in Israel, we'll see outbreaks within the schools. And what we really want to do is prevent outbreaks in the schools, because that can just make the whole picture worse and actually drive up community spread.
What can you tell us about younger children? Do they spread it the same way as adults, and are they just asymptomatic, or is it more difficult for them to actually catch it in the first place?
There is some suggestion that it's more difficult for them to catch it in the first place. They're also less likely to get symptomatic. If they do get symptomatic, they have a fair amount of virus and can clearly pass it on. So I think that there's probably a little bit of benefit to being younger in terms of the chance of getting sick, but doesn't really change the need for precautions. I think when you're at an age like in daycare where kids can't stay away from each other, they can't really socially distance, you need to have small groups that stick together all the time, so you're reducing the chance of an outbreak beyond that group.